Dr. Michelle Warren brings to this community innovation, she brings creativity, she brings dedication as a role model and a mentor.
Michelle has always been really good at looking at the whole person. It's not just about the symptoms that they present with, it's them as a person, them as a family, what works best to really provide the care that they need when they need it.
You just feel really heard with her. You don't feel rushed. I would say that's probably one of her biggest strengths. And I feel she's a very caring person and that she's very loyal to our community. And we are just really lucky to have a person like that who chose to be a physician in our town.
One of the things that I've come to know and love about Sundre is it's got a pioneer spirit and a can-do attitude. Folks love to be involved in the community, to be part of it, to look for ways to improve for the future.
It's almost impossible to explain or to put words to how important it is to have medical professionals who make this community their own, who you know are here because they want to be here and that they care about the people that they care for. Rob and Michelle Warren really appeared in this community over 20 years ago when they were going to university. And Rob's family had a small cabin in Bergen right next to Sundre, and they would come out here on weekends. So when they did have an opportunity to come out here, they decided that Sundre would be a place where they would at least begin her medical career. Michelle obviously fell in love with the community and decided that this would be the place to build her career, to raise her family, and to make this as her home.
Oh, well, hello, old man. I grew up on a ranch. My nearest neighbors were my grandparents, so it was me, my dog, my horse, the cats. That's what I enjoyed doing, right? Just not having anybody else around. It was just family. And so when I come out here, it's just fun. It's quiet, it's peaceful. I love nature. The dogs love it, they play. And then, you know, you'll look and you'll see beavers swimming through. And that's just fun. I knew growing up that I really enjoyed sort of the small town environment. When I was in my grade 12 year, I had an opportunity to work with the local physicians in the community. So I got to see very early on what rural family docs actually did. And I found it to be very intriguing because I knew that I wanted to go into medicine. So there's 2 that could come in for 38 weeks. So are you around on the weekend? So I'll make a note. Call Allison. Okay, sounds good.
In 2013, Michelle and I founded a medical clinic in Sundre, the Moose and Squirrel Medical Clinic. And it's been an amazing run so far. When we decided that we would take the plunge and start a business together and operate a medical clinic together, we knew it was going to be a big job. And we knew the only way that we would be able to do the job we wanted to do was if we were passionate and had a vision about good medical care for our community. Michelle, being the more experienced physician in the practice, really had a good background in understanding what good rural primary care was. And she was the visionary. She was the one who said there's a right way to do this, and we're going to do it the right way, even if it's not the way that it's been done before.
All right. Hey, morning. How are you doing?
Not too bad, thank you.
We knew the Sundre healthcare system, the central zone system, so we knew how things worked. We were willing to make the financial commitment to the community to say, yeah, we believe Sundre is growing. We believe in the community. And we're going to put our money where our mouth is. And we wanted to build a clinic that would be multidisciplinary, that would be cutting edge in primary care in Canada. We wanted it to be open and bright and fun so that patients coming in would start to feel better when they walk through the door, because this is a healthy place, a healthy environment. Yes, and they want to make sure there's not like a neoplasm or something like that there. So I don't know how long it takes to report a PET scan. It'll probably be like a white cell scan. So probably a couple days, but as soon as we see it, we'll call her in and talk about it.
She loves education. She really enjoys mentoring
anybody who comes in, even if they're not assigned to her, but they're working as part of our team on that day, and they say, hey, I don't know anything about that. Is there, can you include me? And she'll say, come along, let's go and do this together, and I'd love to show you through it. I'd love to explain to you why something is happening.
My wife called Audrey at home care saying he's really short of breath on exertion. He denies having any chest pain, but he really seemed to be struggling, but refused to go to emerge. So that she was going to call and try to get him into clinic to see you guys this afternoon.
And to be able to take young doctors, young students into the community and really mentor them and really show them what it's like to be a family physician in a rural setting, that's really special. And our doctors are great for that. They really embrace that program. And Michelle and Rob Warren as well are really leading the way with that.
EMS brought her in. GCS was 4 when they got her. We said her about 7. When I have a student or a resident with me, they're learning medicine. They're learning how to set a broken bone. They're learning how to diagnose an illness or treat an illness. But they're also watching. They're looking not just at me, but at Rob and other people. They're saying, how do you balance your life and work at the same time?
They've got this wonderful commitment that if you live in a small town, you should not have to compromise the medical care that is available for you. And this couple really have attacked that and said, how can we not only be as good as the city center medical care things, but how can we be better? How can we bring the very best of medical care to our people while still maintaining that very comfortable rural approach to medicine?
So what I asked the unit clerk to do is to call admitting in Red Deer and find out. We actually pride ourselves on being called a rural general specialist. For me, I can get the adrenaline of the emergency room, the brain stimulation of the acute care inpatients who are really quite sick and you're trying to figure out, in some of them, what's really going on. Sometimes it's pretty straightforward. Deliver babies, and that's a bit of an energy rush in and of itself. And then also go into and be a business owner. And because I had that experience going into medical school, knowing full well what it was a rural physician actually did, I went through my training saying, what skills do I need when I'm working in a small town, when there isn't a surgeon, there isn't an emergency physician, there isn't an internist. It's me and the patient and my staff and my colleagues. What is it that I need to know?
Okay, he'd been having really bad nightmares, and I guess that can be one of the side effects of if you get a low blood sugar or something.
Yeah. I mean, if he's not getting chest pain or anything like that, he's just...
The reason why Michelle is such a valued rural physician is that she understands the importance of teamwork in a small setting. You have a limited amount of resources at your fingertips and a limited amount of staff, and so she understands the need to work really carefully and closely together.
And so it sounds like she's here because she just wasn't managing at home, lots of falls, and her daughter's also been diagnosed with something similar. So.
I love working alongside Michelle. She inspires all of us to be the best version of ourselves. She's a true mentor. She sees elements in every member of the team that can be made better, and she encourages them to be better, and she supports them to be better.
So I've ordered it, but then I want to hold the natal on Irbesart if the blood pressure is less than 100. Okay. And then I was going to get an ECG because he's bradycardic too. So. Okay. The Sundre Hospital, like most small towns, it's very much a team environment. We work with nurses, we work with LPNs, healthcare aides, we work with pharmacists, lab and x-ray. And unlike a big city hospital, we know our team members very, very well. We not only work with them in the hospital, but we play with them on the Frisbee field. We have children in the same activities or in the same grades, so we're there as parents as well as colleagues. And that is one of the big attractions to the Sundre Hospital. Tomorrow, if it's less than 100, they'll hold it as well, but we'll see what he's like after he gets that blood, right? So, okay, perfect.
Michelle's reputation in the community is really quite strong. She's definitely a pillar and a leader in this community, She's involved in all sorts of different things because not only is Michelle a wonderful physician, she's a mom, she's a wife, she's part of everything that goes on in the community.
You get the hide a bed on Saturday, and then this Sunday you have to share a room with me, David.
Yeah. You have to share a bed with David?
Yeah, unfortunately.
Sundre's home. It is a small town. It is a place where when you go to the grocery store to pick up a few items, it never takes 5 minutes because you run into people in every aisle. And I love that. I love the fact that where I go, I know everybody. And I find them to be very respectful of my time out of the office, which I think scares a lot of people away from living in a small town, is can I ever be off? Can I just be me? And the answer to that is yeah, they really can.
She has played and continues to play an important role to demonstrate the opportunities that there are for medical professionals in a rural community and the life balance that it can be provided with being able to raise a family, being part of a community, and being able to continue to challenge yourself professionally with the requirements of the job.
She is a mom and a spouse and a community member, and she steps up to the plate whenever she's asked. She never seeks recognition for what she does because she doesn't find what she does to be special. She finds what she does to be what a doctor should do and what a member of the community should do. And she is, in my view, a true unsung hero.
No, he wants a stick.
Congratulations, Michelle. We are so proud of you and we're so happy to be able to work with you in this facility. I look forward to many more years.
Dr. Varn, this is Jan Beatty, and I certainly appreciate you coming and being our doctor. And we look forward to seeing you more at the lodge.
I just need to say to Michelle that it's always a very comforting thing to see your face when I'm in need or someone in my community is in need. When I'm in visiting someone, you're familiar, you care, and we're very blessed to have you as a physician in our community. Thanks, Michelle.
Michelle, congratulations for receiving this award. It's been great to work with you and follow your career. I wish you all the best in the future.
Congratulations, Michelle, on this award. You are more than deserving. You delivered, along with your husband, Rob, our second granddaughter. And we are so grateful for your ability to be there for us, to ease our daughter through that delivery, and to be such a dedicated professional in our community. Thank you very much for your service and all the best in the future.
Congratulations, Michelle. You deserve this. Take time and soak it all up. You deserve all this recognition, and we are so grateful to have you as a physician in our community. And don't ever leave. We love you too much. Thank you.